Not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Welcome to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, where mind, mood, and what matters to you are discussed. We're broadcasting live from Toronto, Ontario, Canada, on Reality Radio 101. To get on board right now, send us an email. Our email address is instudio101@gmail.com. And now, right to your host of the Bear Psychology Radio Show, Dr. Anna Baranowski.
Hi, everyone. I'm so glad to be back with you here again today. For those who regularly listen to this show, I know that you are all aware that there was a medical emergency last time, and I was not able to have my show. So I really missed you last month, and I am actually going to talk a little bit about medical emergencies and how that might play out, because today we have the wonderful Dr. Cammy Froude, and she has a very interesting perspective on the medical and mental health. And she's actually got a very interesting background. She's a Ph.D. in human development, but specializes in trauma and health, like health psychology. So this is a very interesting combination. And she has a unique perspective on how physical health and emotional health are related, and what might happen if you have a trauma and some kind of injury or illness or surgery or medical error. And the way Dr. Cammy works is to really take you much deeper than the surface of what you may think. Like, you know, a lot of people talk about cognitive behavioral approaches, but Dr. Cammy is actually going to look more at the physical or somatic. We'll talk a little bit about what somatic means in a minute. We'll define that. What physical experiences can do in your body and how they are related to our emotions, to our psychological makeup, to how that embeds in us. And Cammy does use a number of different somatic approaches, including EMDR and other strategies. And she's also just recently the author of a really lovely book called Meditations, a Guided Journal for Women, Mindfulness Exercises to Inspire Your Practice. Now, I do want to say this because although it says it's a guided journal for women, I have to say, it's not a guided journal for women. It is a guided journal with incredibly beautiful exercises that I think would actually land well for anybody who's trying to figure out what it means to sit with themselves. And I always find that one of the biggest ways in which we move forward in our lives and grow and change and heal is by knowing ourselves. And so I want to really invite Dr. Cammy Froude in to join us today and talk to us about her unique approach. And thank you for joining us.
That was a wonderful introduction. Thank you very much for having me on. I'm so excited to be here. And yeah, let's jump right in. I
Let's
love
do that.
the introduction of really looking at that connection between how we move through the world, the experiences that we have, and then how that shows up somatically. So somatically meaning in our body. How does our body respond to the world, to our memories, to our relationships? And yeah, that's what I'm here for. That's what I do for a living. And it's wonderful, important work.
I remember when I was a graduate student and I first heard about this idea of somatization.
Uh-huh.
And I thought, wow, what that really means is that something got caught inside of my body that's actually emotional, but is playing out in a physical way. So, I might have a stomach ache or a headache or backache or neck ache or just a sense of being unstable or, there's so many ways in which this can play out in a person. And, sometimes we'll think that there's no way to get out of, a chronic pain. And this is especially true when there doesn't seem to be a physical diagnosis, like I've got a broken arm or something, kind of has happened to me that I can pinpoint. Because pain, like if I've got a precise injury, something that has occurred, it's not generally going to be moving all over my body. I might have general discomfort, but the pain, the injury is going to be where the injury is. But when we have somatization, that pain can actually start moving or become more diffuse. I might have a pain in my stomach and then a sense of heaviness in my chest, and my neck might get very stiff, and I might get eye soreness, and my head might hurt. It's moving all over, right? So that's a really good indicator that there's somatization. What are your thoughts about that?
Yes, I mean, when I first started to integrate the body really in with my work as a psychotherapist, because I happened to be in a training center and in a community clinic where we were getting referrals from primary care doctors. So people would come in and say, my primary care doctor told me to come to a therapist, because I have stomach pain. And I was, a trainee and thinking, what am I supposed to do about your stomach pain? And so we would start doing therapy. We would start doing cognitive behavioral therapy. Well, when your stomach hurts, what are you thinking? What are your emotions? And to a degree that was effective in increasing awareness. And so by the time we were done with our therapy, the person would say, well, I like you, Cammy. I love talking to you, but my stomach still hurts. And so that's when I really started to think, okay, in order to be a comprehensive healthcare provider in the broadest sense of the word, even though my specific channel might be mental health, I have to start learning about the body and the way the body and the mind integrate. Because people, whether they're referred by their primary care doctor for what they perceive as a purely organic issue, like a headache or a stomach ache or pelvic pain, there's always a mental health component, which doesn't mean it's not real. It just means that our mind and our body are constantly integrated. Similarly, when someone comes in with what they perceive as a purely psychological issue, I have anxiety, I have depression, there's always a somatic component because we live in our bodies. And so that's when I really started to begin to learn more about the body, to integrate our somatic experiences into psychotherapy work. And I did that by training in a primary care clinic and actually going in with physicians and hearing how clients, or in that setting, patients, individuals, were explaining their physical symptoms. And there was often a psychosocial overlay in the way that those ailments were presented to physicians. So that's how I got started. And the empathy, and it's really part of the motivation to learn more about this and to become well-versed in this connection was the frustration that I would see clients have coming into therapy, talking and getting a lot out of the communication, but their body's still feeling pain and just saying, no one will believe this. Talking doesn't help. And the doctor says they've done the MRI, they've done the CT scan, they've done whatever. There's nothing there, quote unquote. So yeah, my continued work was really motivated by wanting people to get relief at the end of the day. Mm-hmm.
Exactly. That makes a lot of sense to me. And, we were talking about this before, but there's something called medically unexplained physical symptoms, or MUPS. And I had said, in 2001, it was the first time I had really ever heard people use this term broadly, because what had happened after the towers went down on that terrible day in New York was that people started to present at emergency departments and in their physicians' offices with unexplained physical symptoms that were later seemingly connected with the impact of the stress, the sense of being in a dangerous situation and not being able to change anything. And, and a lot of symptoms can look like chronic fatigue or fibromyalgia, non-epileptic seizures, stomach pain, severe headaches, gastro pain. And, the doctors are doing all sorts of tests and unable to really say, there's anything conclusive at all. And, it sounds like that's what you were noticing with the physicians that you were working with. What kinds of stories would you hear?
So many. And working in primary care, when people come in for an initial visit, about 25% have one or more medically explained symptom. And then when you go into secondary care, it actually increases even more. So physicians are equally as frustrated in wanting to help and not knowing how. And, the story, when I worked with children in a pediatric setting, they were stomach aches and having, that perpetual and when we think about it, you don't want to jump to that conclusion. There should always be biomedical examination to make sure someone's not just pushed aside, oh, it's nothing, go see a therapist. Oh, it's nothing, because that's also very common. And so there needs to be some advocacy up front to make sure that the medical components are accounted for. And then when the medical conclusions are, we don't see anything purely organic here that you need a medication for or you need a scan for, then you can kind of move into some of the more integrated approaches. I say that because we'd have kids come in with stomach aches. And when you'd ask them, so the doctor would do the examination and then a therapist would come in. So that was my role at that time. And the question's like, so what color is your stomach when it's hurting? It's red. Okay, what shape would it be? Triangles, darts, they would start to put names and they would start to put colors and they would start to put images with it. What makes those fiery darts come up when mom and dad are fighting? Oh, okay. Tell me more about that. What do those fiery darts say to you? And so you're starting to put some language and some features around the somatic pain in order to begin to start to connect both for yourself as the therapist, so you can know how to help, and then maybe also for the family. But for that kid, hey, this isn't just something that randomly appears. This is something that appears in certain situations. It looks and feels a particular way, which we call, one of the therapies that has been so helpful for me as a medical family therapist is narrative therapy. With Michael White, such a beautiful, beautiful, amazing therapy approach. And if just people can just Google narrative therapy, look at YouTube, there's so many amazing examples of it. But that idea about externalizing the problem. So the idea of externalizing the problem is the person is not the problem is the problem. So someone is not depressed, they are an individual with depression. A kid is not patient with stomach ache, right? They're a child who experiences stomach aches when. And when we start to share that language and start to externalize the somatic experience, people begin to have more control and agency. So that's a couple, an example with a kid with a stomach ache, for example. In adult primary care, I would say the most common one as a trauma therapist was that chronic pelvic pain for women who have a sexual abuse history. That is just the most common one that I saw, again, as a trauma therapist with some specialty in childhood sexual abuse. It just that chronic, and then the inability, without having that, the integrated mind body experience addressed, to get routine primary care needs met. Mammograms, because the sexual experience could be all connected for them. Pap smears, removing polyps if they have PCOS, just the inability to get their medical needs met because a traumatic experience in childhood has stuck with their somatic experience. They don't really know that it's connected, but the body responds, and then the person can't get the help that they need because their body is completely shut down.
Yeah, and that would make it really difficult to kind of tease apart, is this something I need to pay attention to? Or, is it something that I need to kind of lean into because I need to know myself? I need to come to terms that this is a connection between an emotional and a physical problem. Or, do I have a real medical emergency that I have to deal with, and I just really need to deal with it? And that can be really problematic, especially if you've been in the medical, receiving medical care for many years, and, presenting with problems, with physical problems, and repeatedly not getting any relief. And, there's a whole history, and this relates actually more to women than men in terms of the research, that it seems like there's this issue around female patients presenting with pain of various kinds, and doctors concluding, without properly investigating and testing, that the pain is simply something somatic. So, in every single case, I would really encourage people to, do your work, recognize there could be a mind-body connection, but for goodness sakes, if you are unwell, go and get help. And just on that note, I'm going to just tell my own story because it relates a lot. At this very moment, get your own help. Like, seriously, get your own help. I am just going to remind people, if you want to ask Dr. Cammy Froude anything today, she is obviously awesome and a wealth of knowledge. You know how to get in touch with us at instudio101@gmail.com. And here is a email. Welcome back. Oh, thank you so much, Dave. Dr. Baranowski, welcome back. We all missed you last month. This topic affects everyone, period. Thanks for sharing. Well, you're very welcome, Dave. I so appreciate it. And I did miss everybody as well. I love these conversations. So please, if you have a question, instudio101@gmail.com. Now, I said, go and figure it out. If you're having symptoms, get yourself to care. Somebody needs to do some investigation, but concurrently also have some practices where you can start to do some leaning in toward yourself and reflecting on whether there's an emotional component. However, do not be like me, okay? So this is my warning. Last month, I went to a luncheon, and there was a lot of food. A lot of it was yummy, delicious. I love Chinese food, and there was a lot of delicious Chinese food. It was a bit on the oily side. There was cake, there was family, and lots of conversation. And then I even went skating afterwards. So it was a great day. However, as I was coming home from skating, I started to notice I did not feel very well. And I just thought, probably I overate. or maybe I got too involved in the drama of my family. Maybe that gave me a stomach ache, right? So, I'm actually kind of not feeling that well. Monday was a long weekend holiday. So, I took the day off. I canceled everything. I just hung around home, tried to rest, and I thought I was going to be fine. But I wasn't, because Tuesday I woke up and I was even worse. I had woken up and I realized, oh my goodness, I think I'm actually really, really sick. And I ended up with acute appendicitis. My appendix had actually burst. My husband called an ambulance. Ambulance attendant came and said, on a scale of 1 to 10, what's your pain rating? And I had made my way downstairs to our living room, and I was lying on the couch. So by the time the ambulance came, I was like resting on the couch, and I hadn't moved for at least 10 minutes. So I said, right now it's about 6 or 7, but I haven't moved at all. And he's like, he'd already done a little examination and asked me some questions. And I guess at that point, he'd already figured out that I had an appendicitis. And he's like, rolls his eyes, because I think he'd already realized I was in like an acute physical emergency. And he's like, oh my God, you're telling me it's a 6 or a 7? And now, because I'm saying it's a 6 or a 7, he's realizing I have a very high pain threshold, which is true. But I kind of knew something was going on, but I tend to be pretty healthy. So it was so shocking that I wasn't just bouncing back, that it kind of caught me off guard. So, sometimes these things do happen, and you have something real and it can catch you off guard. And whatever you do, if you are in real emergency distress, please call an ambulance, because had I not called an ambulance, I'm not sure how well things would have gone. But I got the best ambulance attendants and such amazing care, and the right care. So, in an emergency, you go to emergency, and don't hold back, take care of yourself. You are needed on this planet. This is from, what's that?
Oh yeah, go ahead.
Yes, go ahead.
I think that's just a really great point. And a lot of this can become really mired, because someone, for example, with a chronic condition that they might be managing with a couple of annual doctor's visits, but a lot of psychosocial support, either in the form of therapy or yoga or whatever. When there's an acute issue, there is always that medical decision-making process. Is this another extension of my chronic illness that I should treat in the same way that I've always been? Or is this something new? And is this a time to pull the alarm? I think, one important way to mitigate the dichotomy of, is this more psychosomatic and I just go with my yoga teacher, my therapist, and my church or my family, or is this an acute issue and I should go to my doctor, is to actually just have a medical team that's frequently checking in, not only with you, but with each other. That is something that I've found really, really helpful as a medical family therapist. Is the first thing that I ask clients to do is, do you have a primary care doctor you trust? Do you have an OBGYN who you trust? Because sometimes the answer is, yeah, I have a doctor. Oh, I don't trust them at all. Okay, well then that's not very helpful for us, right? So just, do you have OBGYN you trust? Do you have a doctor you trust? Even, do you have a dentist that you trust? Oh my goodness, this just came into my head now that you talked about pain tolerance. I had worked with a client who went in a very severe trauma history, and we were working on dissociation together. Would your audience be familiar with a term like dissociation, or is it helpful to describe?
You know what? A lot of people will, because we have a pretty sophisticated
Perfect.
listenership, but please do explain it in your own words, because some people will find that term interesting explained.
Yeah, so dissociation is a very common coping mechanism for individuals who have experienced trauma. When a person is in the middle of a very acute trauma, so let's say a sexual abuse, or being held up at gunpoint, something, and they're unable to fight and they're unable to flee, they will freeze. And then in that freeze, really kind of separate their body from the experience. And so actually it's been when you look at just the continuum of dissociation for people who are listening who aren't trauma survivors, we dissociate just the general population. Like, have you ever driven somewhere and you're thinking, oh my Lord, I just drove 40 miles and I have no recollection of driving that, right? That's a form of very mild dissociation. Similarly with daydreaming, like all of us at some point in time have daydreamed and kind of lost time a bit.
Yeah, that's the, proverbial, you're talking with your husband of, 20 something years, and all of a sudden he says to you, huh?
Yeah.
That's a kind of mild form of dissociation,
yes.
right?
Yes. When your significant other's voice has blended into the tapestry of the environment and you no longer hear it. So what happens is, the person dissociates in the moment with the traumatic event. And again, we're going to see this with longer term developmental trauma. So when the abuse is pretty chronic and consistent, it becomes a go-to coping mechanism because it really does protect the psyche during trauma. It's adaptive when the trauma is occurring. It becomes less helpful when the trauma has ended and you're in a board meeting and you get anxious and dissociated. And then when you're called on, have no idea what to say. Anyway, all that to say, I was working with a client who dissociated, and we were really working on how to stay present and work through the trauma. And she went to the dentist to get a root canal and fainted or fell out. I don't know, fainted, fell out, collapsed in the middle of the root canal. The dentist, and he was checking on her throughout, and she was saying, I'm fine, I'm fine, I'm fine. And the dentist ended up calling me and saying, we actually did not administer correctly the Novocaine, that she was having a root canal without Novocaine and passed out from the pain. But when we were checking in with her, she said she was fine. And so again, just something that you might not think of, like the relationship between dental work and trauma. And should dental providers be trauma informed? How can we prepare a client when you're getting dental? That's such a loss of control. And so again, sort of back to the original point, to create a healthcare team and be in communication. Some people might think that this is, oh yeah, go ahead. Sorry.
Yeah, no, it's such an interesting story because, it suggests a lot of things were going on in the moment with the client when the dentist was saying, how are you? And the client didn't say, I'm in a lot of pain, or I actually don't feel frozen, like just stating the facts as they are. She didn't do that. And this isn't to blame the client. It's just an interesting reality, when there's certain types of trauma, we learn how to tolerate things that, being able to say this hurts is actually a sign of health.
Yes.
Right.
Yes.
And so she somehow wasn't able to use her words and say, this really hurts. I'm in a lot of pain. I don't know why, it still hurts right now. Instead, she just said, I'm okay. And that is really something, and it tells us a lot about what happens to people. I'm going to read some emails. Okay.
Oh yeah.
So
please.
we have such great listeners, and they do make fantastic points. So I want to make sure that we look at some of what we're getting right now. This is from Gwen, and Gwen says, hi, Anna, glad to see that you're back and doing well. Well, thank you very much, Gwen. I'm super glad to be back, and I am feeling really well. She says, don't a lot of psychological issues have a direct effect on the body physically? And yes, absolutely. And you know what? I'm actually going to reference Dr. Bessel van der Kolk, who's really one of the luminaries in the field. And he wrote something in 1994. So this goes back, almost 20 years. But it's so on point for what we're talking about today. And this is an article that actually led to a lot of his work that came later. And the article is called The Body Keeps the Score. He has a book called The Body Keeps the Score, Memory of Evolving Psychobiology of Post-Traumatic Stress. And he writes, ever since people's responses to overwhelming experiences have been systematically explored, researchers have noted that a trauma is stored in somatic memory and expressed as changes in the biological stress response. Intense emotions at the time of a trauma initiate the long-term conditional responses to reminders of the event, which are associated both with chronic alterations in the physiological stress response and with the amnesias and hyperamnesia characteristics of post-traumatic stress. Continued physiological hyperarousal and altered state stress hormone secretion affect the ongoing evaluation of sensory stimuli as well. Although memory is ordinarily an active and constructive process, in PTSD, failure of declarative memory may lead to organization of the trauma on a somatosensory level as visual images or physical sensations that is relatively impervious to change. And here, I will just mention that here is where it becomes very important to recognize that because memories get stored in a certain way in our brains and in our body, it becomes impossible to access it through normal talk therapy because it is kind of locked on a deeper level with inside of ourselves. So we may manifest it in a physical way, we may manifest it in our behavior, but we may not connect with the deeper core content that is now part of the subconscious mind and locked in. So we need to get access to this with exercises and strategies and interventions and therapies that actually help go beyond just normal conversation or talk or support therapy. And that becomes crucially, vitally important. The fourth edition of my book, Trauma Practice, is probably coming out within the next, I don't know, 6 or 8 months, something like that. And we've changed the title from Trauma Practice Tools for Stabilization Recovery, and we've added the word somatic to it because we really recognize that it becomes impossible to get access to certain content if we're not finding strategies that allow us to go deeply into the body felt sensation or the inner lived experience. And so that's what Bessel is getting at. Then he goes on to say the inability of people with PTSD to integrate traumatic experiences and hormonally, tiny writing. The inability of people with PTSD to integrate traumatic experiences and their tendency instead to continuously relive the past are mirrored physiologically and hormonally in the misinterpretation of innocuous stimuli as potential threats. So, that's like, I'm walking down the street and I see a red car and then I get really triggered because, there might have been a time in my life where I had an accident in a red car. And now anytime I see red cars, my body will automatically go to a place of fight or flight. I am terrified. Animal research suggests that intense emotional memories are processed outside of the hippocampus. And the hippocampus is the part of our brain that really collects memories. But it is actually very closely connected with the amygdala, which lies in very close proximity in the brain to the hippocampus. And the amygdala is the emotional control center of the brain. So memories and emotions are very tightly connected in the way the memory system works. And those memories, the body layered sensations connected with traumas, are very hard to extinguish unless we get access to the somatic levels of processing. The effectiveness of this inhibition really depends in part on physiological arousal and neurohormonal activity. These formulations have implications for both the psychotherapy and the pharmacotherapy of PTSD. Now, I've just mentioned that, so what Dr. Cammy Froude is doing is she's recognizing the super importance of somatic strategies and the ability to get access to things that lie below the surface of our psychological or our thought systems. And, you know, there are newer strategies around as well. People are using plant medicines. Ketamine has become very popular in helping people to access some of these deeper layers. And, you know, I'll do a show on ketamine or plant medicines at some point in the future, because it's relevant to a lot of our conversations, and also getting access to those deeper levels of content. Okay, I'm going to go back to this. So we're looking at some more of the emails. Great, this is a great question. Hello, this is from Jazz, and Jazz says, hello, Bear Psychology. That's the name of the company. Where does your guest practice? Tell us a little bit about your practice today, Cammy, where you're practicing and how people get into contact with you, and maybe help us learn a little bit about your fantastic book as well. And I'll ask you some questions about that too. So tell us a little bit about your practice.
Jazz, thank you for that question. I think, you know, one of the things that I have learned is how by the time people call me, they've sometimes gone through 10, 11, 12 therapists or physicians or psychiatrists trying to figure out what's happening. So, you know, just finding someone who you connect with and can relate to, and who actually has the tools and expertise to help you is really, really hard. So thank you for creating this space so I can share a bit about my practice. I practice virtually. I'm licensed in Massachusetts and California, but also it's amazing how much somatic work we can also do in a coaching practice. We don't have to go, unless Anna, you want to, we don't have to go into the differences between like coaching and therapy, but just know that, you know, both are possible depending on the severity of what you're going through. I do practice 100% virtually. I'm an EMDR therapist, you know, basically a trauma therapist, and I use EMDR as one of my main practices. Anna, would your population be familiar with EMDR, or is that helpful to go and explain a bit?
I think it's a fairly well-known approach, but I mean, it's a really important one. So please do explain it based on your work. I mean, I do that work as well in my practice because it is so relevant, and
Yes.
it fits so well in with this idea of somatization and getting to the deeper layers.
Yes. So my practice is called Bliss in Being. And you know, through Bliss in Being, I really, really focus almost strictly on trauma survivors, particularly in the context of their couple relationship or their family. I'm a trained family therapist. So it's not often I'm meeting with someone 100% alone. We might do some sessions alone, but I really would like to include your most significant people, like your family or your partner, because trauma shows up in our relationships. I do, you know, rely on a form of therapy called EMDR, eye movement desensitization reprocessing. It's such a mouthful. The crux of that therapy is the idea that when we experience a traumatic event, our biological urge is to fight it. You all know this, to fight it or to run from it. And when we can't do that, so childhood abuse, there's nowhere to run, there's nowhere to flee, there's no way to fight. It gets trapped in our biology. It actually, our neurochemicals aren't released in fighting or in fleeing. And so it gets trapped. The theory behind EMDR is adaptive information processing. So it's the belief that when we can't release the trauma that we experience, it actually gets lodged in our memory network, both cognitively and also somatically. And so we just keep replaying and reliving that trauma over and over again. The example of the red car is a perfect one. You know, that the reticular activating system, if I tell you, do not notice any red cars the rest of today, all of you all are going to notice red cars today and you will think of me. So it's what we're primed. So our body says, okay, we were abused by this type of person. He or she or they look this particular way. And so now we're going to look out for any feature that resembles that abuser because we're stuck in the trauma. And then our body's going to get ready to fight or run again. So what EMDR does is actually brings, and the thing that's so, before I was EMDR trained, so frustrating for both clients and myself, is they would come to me and say, Cammy, from the neck up, I know this is not right. I know it. I've done cognitive behavioral therapy. I've done my affirmations. I know I'm a good person. I know I deserve happiness and peace. But from the neck down, my body is on a whole different plane and there is nothing I can do to make it calm down. And so what EMDR does is it's really not, I don't even need to know about your trauma. It's so fascinating. It reduces the vicarious trauma for the therapist. It also helps clients who don't want to talk about their trauma. Of course, if you want to and you need to, I hear that all the time and love to hear those stories and be the holder of that information. But if you don't want to tell your trauma story, we literally just work from the neck down with doing eye movement processing. Basically getting you into a rapid eye movement state using several different strategies. And through the eye movement state, we'll bring the trauma up into the forefront and your body will actually reprocess it, thereby leaving you with the memory of the trauma, but no fight or flight response from the neck down. So that is the type of therapy. And then bringing in significant other, family, whoever is important to you, and helping them understand, hey, your partner or your sister or your best friend is a trauma survivor. And this is what this means. This is why he, she, or they do these particular things, feel this way. Here's how you can create a safe holding environment in your sexual relationship, at your family dinners, to hold the experience that this person has lived through.
Cammy, I wanna go to something in your book because I think that you're kind of opening up, practices that people can use really to get access to some of this stuff that really lies inside, even beyond the therapy session. And I want to just remind people about the book that Cammy just recently published, which is Meditations, a Guided Journal for Women, Mindfulness Exercises to Inspire Your Practice. Now, the thing that I really loved about the book is that it's broken into kind of themes or concepts, things like community, or meet your happiness, or fear be gone, or space to choose, or daily wonder, the concept of awe. I can be anything, and there's more. I mean, that is not everything. But then you go into these beautiful little exercises, things about what happens when you bring awareness to your posture, for example. And then you give these beautiful affirmations. And one of them is, my body is a channel for light. I choose ways I present to myself and to the world. Now, can you tell me a little bit about the inspiration for this book and how it relates to this mind, body, or somatic strategies that we're talking about today?
Yes, thank you for highlighting those and bringing me back to the writing of that book. Maybe just like very true to a scientist practitioner, every single thing I've ever done in my professional life has been fueled by my clients. If I've explored a question in a blog, it's always because a client and I have been stuck together. If I read, this book was inspired because the beautiful people who I meet with, they cognitively know who they want to be. They cognitively know, I want to be kind. I want, whatever their thing is. I want to be peaceful. I want to be an advocate. I want to be inspired. I want to be joyful. But their body will sometimes show up as jealous, angry, spiteful, depressed. And that is extraordinarily frustrating for them because they have an idea on who they want to be and their body will not follow along because it's trapped. And so part of my work and the motivation for the book is I wanted people to begin to have exercises at home that could support their body in moving forward with their mind in who the person wants to be identity wise. So for example, I think one exercise in the book is cognitively, so the example is my friend forgot my birthday, right? And cognitively, I think many people would think that happens. It's okay. My friend loves me. They remembered a couple days later. But the body is angry, depressed, frustrated. No one loves me. No one cares. And so one of the exercises in the book is to be present to the pain for something, maybe birthdays are super special for some people. It's relatively innocuous. It's a small mistake in the grand scheme of the world. And just be present and honor what's going on from the neck down. Like really just understand, where did this come from? What is the body holding on to? And generally it's going to go back to childhood with a negative core cognition. I'm not good enough. I'm not loved. I am not worthy. And that's what the body's holding on to. And the mind, who might be 45 years old, is thinking, what are you talking about? Of course we're worthy. Of course we're okay. And so one of these exercises is a way to honor the body and allow it to catch up to the development of the mind. And that's done through, cognitive behavioral therapy exercise of what do we know is true? What do we know is a fallacy? How can we honor what our body is holding while also remembering all the amazing things this friend has done for us? And to really sit with the dialectic. People can be amazing friends and also make mistakes. And it's okay to sit with that conflict.
So I want to just tell people, I mean, I can see it. I just pulled it up. It's on Amazon and it is for the very reasonable price of $14.39 in Canada. So I don't know what it is in the US, but it's very, very reasonably priced. But it's actually a beautiful book. Like when you have your hands on it and all the different colored pages and the different exercises, it's very appealing to look at it. And it is short and sweet and really kind of gives you a chance to sit in contemplation on a lot of really beautiful themes. So if you're interested, or if there's somebody in your life who might enjoy a book like that, it's available. And it's Meditations, a guided journal for women, mindfulness exercises to inspire your practice. And it really is just lovely. I want to read this next email because it's really fascinating. This one is from Nancy. And thank you, Nancy. This is a very thoughtful email. Dr. Cammy, what advice do you have for clients who feel dissociation and even sometimes depression due to 18 plus months of COVID caused relative isolation? I feel like it is impacting my optimal ability to socialize as well as I used to. Nancy.
What an insightful listener.
Yeah, exactly.
Yeah, even just Nancy, I think the fact that the question itself makes me hear what I'm hearing is you've made the connection that the isolation has possibly created some dissociative patterning where you're feeling disconnected, not engaged, and then that coping mechanism begins to feel like a comfortable blanket, even if there's a part of you that doesn't like the blanket, there's another part of you that does, and it becomes this internal conflict, and then it's easier to withdraw. I think the first part is really awareness, and recognizing, these connections are happening. And then to engage with what you've become aware of with compassion, unconditional regard. Why do I feel safe in this cocoon that's developed? What's stopping me from moving out of it? What do I fear? This next part is really hard. And so it's helpful to do that with a therapist or a friend or a family, to begin to do the very small exposures. So once we identify what's going on and have compassion for what's going on, it's working to step outside of that comfort zone little by little. So first outing, you're not going to go to a rave in Boston, right? Like that's not going to be the first outing. But taking a walk with a close friend, again, feeling what's going on in your body, recognizing what you're thinking, coming back to baseline, then doing a little more, coming back to baseline, doing a little more, coming back to baseline. And just relating to yourself with a lot of compassion, while also doing some of the evidence-based strategies we know with some, anxiety and holding on to coping skills that are no longer serving us, is to step out of them little by little with a lot of support. What do you think, Anna, about that?
Well, I think I'm hearing it from a lot of people. And one of the things that I'm hearing is actually, now she mentioned depression, and I think about depression in this context as boredom. Because I think what's really happening to a lot of people is that, reasonably, we've all been told, stay home, that's safe. And now all of a sudden we have to say, no, go out, that's safe. Now, how are we going to make that big leap, right? It's like we've got to go from one extreme to the complete opposite and the other. Actually, yesterday I went to a gym for the first time since COVID, March of 2020. March of 2020. Today is 2022. And I stopped going to the gym in March of 2020. I exercised, but not at a gym. Now, for the first time I was at a gym, virtually nobody was wearing a mask. I mean, maybe 1 out of 10 people was wearing a mask. I was one of those 10 people because, this is the first time I'm at a gym and I was like feeling a little nervous, right? So I wore my mask and I told myself that was okay. And I gave myself limits of comfort. So I would suggest, if you're struggling with this, you give yourself some limits of comfort. What do you need to do? What do you need to do to make stepping outside the range that you've been in comfortable, or as comfortable as possible for you? My limit was making sure that I had a mask with me and that I was going to put it on if I wanted to, which I did. And I felt really great about that. Nobody harassed me or anything. It was a very respectful setting. And it was a big gym. It's a really big gym, the one I went to. So I wasn't even close by anybody anyways. But I would ask you to figure out what your limits of comfort are. What can you put in place to make sure that you feel comfortable enough and take a small step forward? Because usually the kind of depression that is being expressed here is a depression of these strict limitations. And I think I'm seeing a lot of individuals with depression based on strict limitations that we were told were part of our safety. So I would really figure out those strategies, make yourself comfortable, figure out what you need to do, take baby steps and do what you can today. Start doing it in the smallest steps you can think of, and increase slowly over time. And, I'm really suggesting the same kind of stuff for as many people as possible. You start to get more comfortable over time. And the great thing is if you've been vaccinated or triple vaccinated, or you're going for a second booster or whatever it is, you are very, very well protected. I believe in the research. So that's what the research says. And I'm going with that. And, I think it's really just important to be aware. We're not seeing hospitalizations and serious illness or death amongst people who've had booster shots. We're just not seeing the same numbers as those people who have had no vaccination. So make sure you're safe if you are going to go out. Now, um, this has been a great show. I'm so
It's
delighted
flown
that,
by.
what's that?
It's flown by.
Exactly. And that's what always happens with these shows. Like they're great. The writers are incredibly bright. The people who write into the show kind of are thoughtful, and they understand, these issues are affecting people everywhere. And it's just not unusual, if you find yourself in a position where you're feeling physical symptoms, especially if they're chronic, or they're things like if you've been diagnosed, let's say, with fibromyalgia or chronic pain, or something that's chronic that just doesn't seem to be resolving, and the doctors aren't finding a physical reason for it. Start thinking about your life through the lens of chronic stress, tension, and understand what might be at the root of that. Now, that's not just a conversation. That takes deep contemplation and work. It takes finding the right kind of therapist who can help you work with that. I like the Curable app. Have you seen that, Cammy? Are you familiar with Curable?
Yeah.
And the work of Dr. Howard Schubiner, and the work he's done with fibromyalgia, and looking more deeply at the combination between the mind and the body and how these things are connected. Because what can happen when you go to a traditional medical doctor is a lot of those symptoms can just be overlooked, or you can start getting a whole bunch of different prescriptions, none of which really seem to make long-term difference for really big struggles. Now, one of the things that we've seen pretty consistently is people who have symptoms like this, severe gastrointestinal problems, fibromyalgia, chronic headaches, often there's a history of trauma. Maybe it's divorce, parental divorce, or abuse or neglect when you were a child. Maybe there's sexual assault. But these things, if they're in your history and you're also having physical symptoms, you may actually be able to connect with the historical trauma, things that may have happened to you when you were just 5 or 6 years old. And that may seem like a big leap, but it's really worth taking the time to peel back the layers of that. What do you think, Cammy?
You deserve it. That's what I always say. And I want to just also remind people, with the advances that we've made in psychotherapy with the mind body interventions, you do not have to be in therapy for years and years. We can bring PTSD symptoms down to nothing, often within 12, 16 weeks. Now, that doesn't mean you're not going to want to continue your self-exploration, but just know that going to therapy is not a weekly, lifelong commitment. You can come in, we can focus on one really specific symptom or a constellation of symptoms. We can bring it down, and then you can go back into your life. Ultimately, you deserve to have peace, and you deserve to know how the different elements of your mind, your body, your spirituality, your history, even your family history impacts the way you show up at work, with your family, with your kids, with your partner.
I want to just give a plug to another book. When I was just recovering recently, somebody very kindly sent me a book, and it's called What My Bones Know, a memoir of healing from complex trauma by Stephanie Froude. And I have to say, it's one of the best books that I've read from the perspective of an individual directly experiencing trauma, talking about her history and making a connection, a very clear connection to what she was experiencing in real time, and the kinds of strategies that seem to really take her to a stable or a better place in terms of her trajectory. So it's really actually a well-written book. has a lot of insights. And if you know somebody who's experienced trauma and they want to learn a little bit more about themselves or maybe make some connections, Stephanie Fu, What My Bones Know, a memoir of healing from complex trauma. It's actually great, and it fits really well with the listeners here. So on that note, Cammy, do you have any last few words that you want to say? And I want to also say thank you so much for joining us today.
Yes, thank you. What I always say to people who I care about, who have connected with me, is I believe in you. I believe wholeheartedly that you deserve to understand yourself, that you're going to do amazing things in the world if you're not already doing them. And I'm here for you if you need me.